Hi friends, I am Dr. Pratap Singh Rathod. I have done the MD in Forest Medicine. Today we will continue with agriculture compound poisoning. In that we will discuss about aluminum phosphate poisoning. Aluminum phosphate is a solid fumigant pesticide, insecticide as well as it is also used as a rodenticide. It is widely used as a grain preservative. Mainly it comes as a tablets which are placed in water and placed in the grain storage areas which releases poisonous gas which are poisonous for pests as well as rats. Aluminum phosphate on coming in contact with moisture liberates phosphine gas which is poisonous for all living organisms. It has a garlicky odor which is pathognomic for any person if person has consumed aluminum phosphate will be very easily to detect because of its odor. In India, it is used available in white tablets as sulfos, alphos, quickphos, phostoxin, phosphotex are different names, each weighing about 3 grams. Phosphite and hypophosphite of aluminum, which are non-toxic, are left in the gardens after it is treated. So it is mainly used as a grain preservative in form of tablets. As I mentioned, the tablet is placed in the grain storage area and it releases poison gas and it causes the toxicity. Coming to action, aluminum phosphate is presence of HCl of stomach releases phosphine gas. So if the person has consumed the tablets of aluminum phosphate, once it comes in contact with HCl, it releases phosphine, which via inhalation and ingestion causes systemic toxicity. The phosphine inhibits respiratory chain enzymes and has cytotoxic action. It acts by inhibiting the electron transport resulting from preferential inhibition of cytochrome oxidase enzyme. So it usually causes the cell death. Phosphine is a systemic poison and affects all organs of all body. So phosphine can be absorbed. It can be absorbed from stomach and by stomach or inhalation, and it is systemic, so it can affect all the organs and cause cell death by all the tissue. Coming to absorption, phosphine is rapidly absorbed from GI tract by simple diffusion and causes damage to internal organs. It is also rapidly absorbed from lungs after inhalation. So it can be absorbed from either by stomach or as well as by lungs through phosphine gas. So phosphine, which is gas which releases from the stomach, is absorbed from the lungs, and the aluminum phosphide is also absorbed from the GI tract. After ingestion, some aluminum phosphide is absorbed and is metabolized in the liver where phosphine is slowly released. So from GI tract it enters the liver where the phosphine is released, and from GI tract phosphine gas is released because of moisture and which is absorbed from the lungs. So this phosphine is the poisonous part which has the systemic toxicity. So from liver it is slowly released accounting for prolongation of symptoms. Phosphine is oxidized slowly to oxyacids and excreted in the urine as hypophosphite. So from liver phosphine is released as well as it is excreted by slowly to oxyacids as well as hypophosphite. It is also excreted in unchanged form through lungs. Come to signs and symptoms. Fetal dose of aluminum phosphide is 1 to 3 grams or 1 to 3 tablets, and inhalation of phosphine at a concentration of 400 to 600 ppm is fatal within 1 hour. Fetal period is 6 to 12 hours. Majority of die within 24 hours after the person has consumed the tablet. The signs and depends on the dose and severity of poisoning. First is the inhalation route is the commonest route. For inhalation can cause mild, moderate and severe toxicity. Mild inhalation exposure produces irritation of mucous membrane, acute and respiratory distress. Moderate inhalation toxicity produces ataxia, numbness, paresthesia, tremors, diplopia, jaundice, muscular weakness, incoordination and paralysis. Severe inhalation toxicity produces alert respiratory distress syndrome, cardiac arrhythmias, congestive heart failure, pulmonary edema, convergence and coma. So majority of symptoms, all the vital organs are affected because of the inhalation. Ingestion, it causes symptoms GI disturbance like nausea, vomiting, headache and abdominal pain, and patient usually recover after ingestion if it is removed immediately. In GI it causes nausea, vomiting, diarrhea and retrosternal pain. CVS it causes hypotension, shock, arrhythmias, myocarditis, pericarditis, acute congestive heart failure. In RS it causes cough, dyspnea, cyanosis, pulmonary edema and respiratory failure. In liver, it causes jaundice, hepatitis, hepatomegaly, and in kidneys, it causes renal failure. CNS, it causes headache, dizziness, altered mental status, restlessness, convulsions, acute hypoxic encephalopathy, and coma. Afterwards, the person dies. Rarely, there is muscle wasting, tenderness, and bleeding diastasis due to widespread capillary damage. The cardiogenic shock is the most common cause of death because of aluminum phosphide. Complications: if the person survives because of poisoning, there leads to pericarditis, acute congestive cardiac failure, acute massive gastrointestinal bleeding, and acute respiratory distress syndrome is seen. Mortality by aluminum phosphate is up to 35 to 100%. So it's so toxic that 35% of time the person may die if not treated. Coming to treatment, inotective intubation is done immediately because the phosphine to remove phosphine gas, oxygen is started, intubation airway is secured so that the person can breathe properly. Then next is the gastric lavage to remove unabsorbed aluminum phosphide. Usually it is done with potassium permanganate. It oxidizes phosphine to non-toxic phosphates and repeated for 2 to 3 times till the all the poison is removed. Alternately, activated charcoal 100 grams orally mixed with sorbitol is also done to absorb the phosphine which is present in the stomach, phosphine gas. Next, followed by antacids are given to reduce symptoms pertaining to stomach and reduce absorption of phosphine. Liquid phosphine is given for excretion of aluminum phosphide and phosphine from the gut. There is no specific antidote for aluminum phosphide, so just symptomatic treatment is provided. Magnesium sulfate reduces organ toxicity, corrects hypomagnesemia and arrhythmias. To treat shock, 4 to 6 liters of fluid is given and it is repeated till the person recovers from shock. Low dose of dopamine infusion, 4 to 6 microgram per kg per minute is also useful. IV hydrocortisone, 400 mg 4 to 6 hours is highly effective. It reduces the inflammatory reaction, so it decreases the inflammation as well as the toxicity caused by cell damage. It also reduces the dose of dopamine requirement. Hypoxia is treated with oxygen by intubation. Metabolic acidosis should be corrected with IV sodium carbonate. Peritoneal hemodialysis is also useful in removing the aluminum phosphide. Coming to PM appearance, postmortem appearance, typical garlic-like odor is present at the mouth and nostrils and in the gastric contents, so which can be indicative of aluminum phosphide. Blood stain froth is found in the mouth and nostrils. Mucous membrane of lower part of esophagus, stomach, and duodenum are congested, mainly because of asphyxia signs. Lungs, liver, spleen, kidney, and brains are also congested. Again, sign of it is also all the sign of asphyxia will be present. Central hemorrhagic necrosis of liver may be seen in some cases. Chemical test to confirm the bedside test to confirm if the person has consumed the aluminum phosphide. Usually their flask is taken and stomach is filled with gastric contents. On the top of the flask, filter paper is placed which is dipped in silver nitrate. So silver nitrate when it comes in contact with phosphine gas, it turns black in color. So that is indicative. This is a typical test to confirm the aluminum phosphide. So 5 ml of gastric aspirate and 50 ml of water are put in the flask and mouth is covered with filter paper impregnated with silver nitrate. The flask is heated at 50 degrees centigrade for 15 to 20 minutes. If phosphine is present, the filter paper turns black. So once it is heated, it turns black. A piece of one more test is if the person is alive, then filter paper impregnated with silver nitrate is placed on the person's mouth as a mask through which the person breathes for 5 to 10 minutes. The filter paper turns black if the phosphine is present in the stomach. This is an indicator of the person has consumed aluminum phosphide. Coming to circumstance of poisoning, usually it is suicidal in nature, occasionally accidental because of mistaking for medicine the person may consume, or children's accidentally may consume the aluminum phosphide tablets. So they look like a tablets and can be consumed. Rarely it is homicidal because it is very painful. It's not done homicidal, but suicidal or accidental causes is commonly seen. Coming to next phosphide is zinc phosphide. This is also similar to aluminum phosphide. It is a steel grey crystalline powder with a garlic or fishy odor. Symptoms are similar to those of aluminum phosphide but are usually slower to start because of slow release of phosphine. compared to aluminum phosphide. It is also used for grain as well as rat poison. Some patients usually die because of pulmonary edema within few hours. Most patients die within 30 hours of exposure, secondary to cardiovascular collapse due to direct myocardial toxic effects. Fatal dose of zinc phosphide 2 to 5 grams. Within 24 hours, the person dies. Treatment: the patient is moved to the fresh air. The poisonous gas or fumes are present. Stomach wash is followed by instillation of milk, starch, or lavage for 35% of sodium bicarbonate to neutralize the gastric acid so that the further phosphoric gas is not released. Active charcoal to remove unabsorbed poison, and purgatives is given to increase the excretion of phosphide. Postmortem appearance: again there is garlicky odor is present, blood is cherry red in color, congestion, edema of the lungs and other organs are seen, fatty generation, necrosis of the liver may be seen. These are my references. Thank you.